imagine an ideal world in the future, whether that be an augmentation of a virtual hospital aligned to an empowered citizen, aligned to information that flows without boundaries across all health dimensions. That capability exists today.
Hello, I'm Dr. Shetty. Welcome to the Future Health Podcast. This is the podcast about the way we work, the work we do, and how technology will influence the future of work in the healthcare industry as a whole. Our guest today is Dr. Mark Simpson, Chief Clinical Information Officer, eHealth New South Wales. I look forward to discussing with Mark on how he sees digital health evolving to deliver healthcare in the future. With me next is Dr. Mark Simpson, the Chief Clinical Information Officer of eHealth New South Wales. Mark, would you care to introduce yourself for us?
More than happy to. Many thanks, Dr. Shetty. I've had the pleasure of obviously working very closely with you, in particular 2019. So my background a little varied in that I am 30 years in the growing as an emergency physician. Then gave the opportunity to become director of both emergency medicine and then medicine. And then I became a chief clinical information officer back in 2011-12, both at the local and the regional and then at national level. And the only part that was missing was the opportunity to then have a CCIO role internationally. And I had the pleasure of being appointed as the CCIO for New South Wales of January 2019. And that then brings us across the time to date, which is the experience and the pleasure of working on behalf of New South Wales Health as the Chief Clinical Information Officer.
Okay. So in your current role, what do you see as your big challenges at this point which you're facing?
At this juncture, Amit, the obvious one is the ability to respond in a most effective way for the challenges that we face, not only as a state, but as a global health fraternity to the threat of COVID. The events of the last 6-7 months have been both challenging, testing, but also a great opportunity to galvanize health as a responsive system, the ability for, and in particular for our own state, the ability for health to respond in a most effective way. Not only health in the frontline staff and the ability to deliver care under such trying circumstances, but also in my own environment to galvanize the opportunities that digital health can bring to deliver safe care under such extraordinary circumstances. So I would have to call out, not surprisingly, the extraordinary events of the last 6-7 months.
Yeah. And in any particular, do you mean virtual health in those sites, or
so
is
one of the opportunities, Amit, has been from the state is how we can react and respond as New South Wales Health and using such technologies, as you say, as virtual health and virtual care delivery. Many of the features of telehealth, telestroke, virtual care and all that it can become had been in different phases over the last 20 plus years in the state of New South Wales, in part for information. So a lot of the groundwork has been done. Hard yards have been earned across the state in many health environments. And really the last 6 or 7 months has been a galvanizing of that hard work, but really to deliver the ability to manage care closer to home, remote monitoring, the focus on how do we enable and increase resilience of aged care facilities. The ability, as was right at the very beginning of this event, was there were concerns that patients would become isolated from their loved ones, from pastoral care, so that isolated patient and the ability to connect them through virtual care, and also that broader arc that we had been working on as a state and as a health system over, as I say, many years, which is how do we share information, how do we connect between patients, carers, and their clinicians, and also how do we peer-to-peer, how do we share between clinician to clinician the opportunities that you don't have to travel, that we can actually enhance care, connect, communicate using established platforms and optimize care, especially in the face of COVID, where significant concern for patient safety, professional and staff safety was paramount.
Almost highlights how this crisis has almost exploded this overnight and brought it to the fore. How do you see this now translating into general care into the future beyond COVID?
So we've already seen as a society, we've really changed the way we approach work, as we've seen from citizens of New South Wales and beyond, the ability to work virtually. The expectations now have changed, even in that relatively short time. The ability to have a virtual option for healthcare delivery is now going to be part of a suite of capabilities that citizens and patients of New South Wales, in my view, will become a norm, will become an expectation. The distances obviously was one of the major focuses of the work in New South Wales over many years. The huge distances that some patients have to travel, yet the return on that travel time with clinicians could have easily been imparted by a virtual opportunity. But really we're looking at, because of the learning curve and the experiences of the last 7-8 months, is really how do we create an opportunity that goes beyond a small select group of patients? How can we make this a mass appeal, a mass option for healthcare delivery, where it's optimal? And I think it also has to work very closely in this mosaic or hybrid model with traditional models of care. So that optimal sweet spot between virtual care delivery and traditional model is really what we're trying to work our way through.
Just want to take you away from a bit more about the COVID and virtual care. I know the last 6 months have been tough and that's where you've been focusing on. What are the other key challenges you've been looking at as a health system in New South Wales Health, which we need to build upon to be able to deliver the healthcare of the future?
So much of the work that was already being done, even before COVID came along. I had the pleasure of going to North America to have a look at some of the methods and design working. So within my directorate, my team that I work very closely with, we're very much focused into 4 broad groupings. So that design aspect, the way that we can actually make the future of design of digital health much more usable, accessible, in keeping and fit for the purpose of the clinicians and patients that use them. How that then aligns with my next group, which is that clinical engagement. So even though I am at the state level CCIO, there are 32 of me across the state representing the districts and networks. So how do we broaden that out to very much be in keeping with what the districts and networks hope and expect? The next part, as you know, close to my heart, is being patient safety and that level of quality assurance. How do we design safely into the system that digital health is a force multiplier for safety? And the last part we've already touched on is a new design of business model around virtual care and the whole acceleration of that model in keeping with the experience of COVID over the last 7 months.
When you talk about patient safety, there obviously are 2 clear themes: safety of the patient through EMR and safety of the patient in EMR, the 2 aspects. And that's where the design and the flow issues of EMR comes in, and then using EMR tools to provide patient safety. They're 2 different aspects. Are you working separately on those, or is it?
So there are fundamental pieces that really across the world, and in particular around New South Wales, that we've been trying to work on. How do we lift up the ability for care to be delivered? So the EMR, so the electronic medical record, a foundational piece of the last 20 years summation of work. Another cornerstone of that really is the alignment of the electronic medical record with the ability to electronic prescribe. Without those 2, the foundation pieces are going to really struggle. Immediately upon that, you can see that the opportunities to deliver care, the communication that flows in and around patient care is paramount. That, and as we've just reflected on, patient safety then starts to come to the fore. How do we ensure that working in a digital world aligns with the highest quality and assured patient-safe delivery of that care? So really those are the challenges that we've had over the last, in particular, 5 years, but it's really been 15, 20 years in the making. The penumbra now is that those foundation pieces in and of themselves are whole-of-state deployments. Many of our clinicians, practitioners across the state will already know. The challenge really is now to start to get to that Horizon 2, Horizon 3, how do we more personalize it, not only to the patient and citizen, but also to the clinician and practitioner, that it fits better for my work environment, that it understands and appreciates what my requirements are, whether I'm the patient or whether I'm the practitioner. So that next arc in the next 2 to 5 years is really to shift the balance from foundational delivery across the whole of the state to ensure that every care opportunity and pathway has a digital basis. But the next phase really is to harmonise, to enhance and optimize that care that really is fitting of the care pathway. So not all of the care can be delivered by this one broad approach. And it's trying to ensure that that is as optimized and personalized for as wide a population of the 150,000 staff we have and the 8.5 million citizens.
Are there any specific projects or pilots you've tried out in the last 12 to 18 months of being here, which have shown really good promise for New South Wales Health and what the future could look like?
So many of the pilots, we've got an innovation zeal within New South Wales, and it's fantastic to see not only is the innovation, both technical and clinical innovation, within eHealth, but also in a broader approach within the districts and networks. We've had, as you know, Amit, much of the engagement around the whole sepsis pathways. We've had an ability to look at and pilot the ability to semi-automate the safety profiling of case management within health environments, live and real. One of the biggest challenges that you and I face, Amit, has always been how do we make right on our promise to reduce the administrative burden from our clinical practitioners in the front line. And my colleagues will always call me out, and the CXIOs and beyond, how do we make sure that this does not become an increased burden to deliver care, but actually a smarter system that can take some of that administrative burden away from our frontline staff?
And that goes back to the comment you made earlier around the design teams, of designing it up front to make sure that one of the outcomes is to reduce workload, not to increase the workload and the design flow.
And again, close to both of our hearts has been the expansion of that design capability. That not only at the level of human-centered design, human factors, usability, but that innovation, that actually how we roll out digital platforms very much hits the right note first time. Because that in and of itself imparts a safe delivery program. But that takes a lot of work. That's getting close, very much closer to the front line. That means there's a strong clinical engagement. And the next phase going forward, Amit, is going to be, and how do we ensure that for a wider patient engagement? And even beyond that is that citizen well-being engagement. Because to the citizen / then patient, this is all one long continuum. They don't see the divides between one care organizational structure starting or finishing. They see that the care is a panacea of a long pathway. And that's really where our challenges come in. How do we ensure that there's no a staccato approach? It's good, it's not so good, it's good, it's not so good. How do we have the highest level across the whole of the care paradigm?
And it's seamless and feels seamless as well.
That's the target.
One of the areas which you highlighted and which comes to fore through that discussion is the level of digital education. Do you see that as, what have your observations been on that space in New South Wales Health in general, especially coming from overseas?
So this is probably one of our fundamentals, how to marry up the broadest sense of education. So here we just be careful of what we mean by education, training, instruction, guidance, support. There is an educational structure that already exists, and we have a very engaged process with HETI, with those districts and networks, with the learning fraternity. The challenge we've got, though, is with digital health, digital platforms, how do we marry the education training? One of the challenges of our clinicians that they've called out quite vocally is how do we not keep having a geometric increase in the demands to being a proficient clinician practitioner in an ever-increasing digital world? At the moment, it feels like 20 to 30 hours. In next year, it'll feel like more. And maybe if it's up to 40 or 50 hours. So one of our remits is, how does this feel more that we're learning and educated in the most advanced model? It doesn't feel like the modular approach that we've had before. It's very much beholden then, Amith, on the design feature of the platform itself. Many of us already have a limited need to sit down and do a module for the device in our pocket or the device in our hand. We don't sit down and do a learning module. Now, health and education combined is not as similar as using your Samsung or your iPhone. But that theory around that education optimization, the usability, the psychology of learning, this is very much part of the clinical engagement division. And I've had the pleasure of having Sarah Dalton, who had worked extensively for ACI and across the state, who's now come as my Director of Clinical Engagement. And education is a significant component of that. And I would also call out, it really marries up across the likes of the foundational pieces, EMR, e-medication, but also, not surprisingly, it's an incredibly strong feature of patient safety. So that interwovenness, but at the same time, how do we not fall into the trap of just asking more of our frontline staff to do more education, more training? That really does call out for our genius level usability and human factors staff. Design the platform that feels standardized. It always does what they expect it to do every time.
Across the state. How do you see all this increased interconnectedness and technologies and the platforms change the way we work, obviously with virtual care and the worker and the workplace? Do we see that? Just a pie in the sky view of what you think it would look like.
I think one of your challenging questions is imagine an ideal world in the future, whether that be an augmentation of a virtual hospital aligned to an empowered citizen, aligned to information that flows without boundaries across all health dimensions. That capability exists today. The challenges are that we have to solve some of the legacy challenges, that many of the digital baseline and the foundational pieces were not yet engineered that they were all going to connect, that the information flows. A challenging environment is the citizen of New South Wales can purchase many and varied modalities that can measure many parts of their health and biometric measures. How do we utilize that resource potentially? How do we ensure that there's an ability to harness what's useful into primary and community care, mental health and well-being? And then how do we ensure that that links in the most effective manner with health facilities? The challenge there is that interconnectedness. Not only just the interconnectedness of information flowing, but that interoperability as well. And the safeguarding against this, though, is that there's an amount, a sheer volume of information that now needs to be managed, handled, supported, and understood. So what we wouldn't want is that fire hose approach to unredacted, unfiltered exposure to all information being gathered across the state by every citizen. Though the challenges that our primary care colleagues would call out, and reciprocally our secondary care, they need each other's information, but in the way that they need it. And I think that nuancing, that personalization, optimization is really the watch phrases that will continue to come back over the next 2 to 5 years.
Mark, you highlighted there through your portfolios, clinical engagement. One of the biggest challenges for the future is stepping further than that and moving into the space of patient engagement and clinical frontline engagement to understand what the system needs to deliver for the patients and not just for the clinicians. Do you see that as a big challenge?
Look, I think that the history of digitally delivered care has been checkered, and I'm part of it. I was built upon the promise all those decades ago. Getting involved as a senior clinician was to deliver the vision of digitally enabled, patient-empowered care. The challenge is then to deliver that, but also to bring the patient and beyond, to bring the citizen. So it's not just that we only manage those with illness or injury, but that next penumbra that we are all citizens. Not all of us are overtly ill or injured, but we have optimization of care, well-being, the challenges that we face as a society, mental health, mental well-being, diet, obesity, that whole, how do I optimize my health delivery as a citizen, not waiting then to be ill or injured? And that's probably one of our biggest aspects of care as a society. However, we have to then marry that up with bringing the citizen and the population with us. There's always a concern for the population of what's going to be done with my information. Who's going to have access to it? What control do I have? And how do I understand who's involved or enacting care on my behalf? And many of the patient representatives and consumer citizen reps that we have as part of our working practices, both in eHealth and beyond, very much highlight for those clinicians and practitioners that they know and trust very well. Not surprisingly, they want them to have full access to their digital record and with no impediment. And it's that, how do we bring the population that there's a level of trust, there's a level of assurance that the patient and citizens' expectations are matched with a safe and delivered health system. So it's that marriage between the two, because if we push too hard and go too far and the citizen feels as if this isn't done in their best reason, we'll find incredible resistance. And vice versa, if their expectations, and there is a challenge here, sometimes the citizens' expectations rise rapidly, just the capabilities, we all know, Generation Z, the millennial, their comfort, their alleged comfort. Now, there are some other generations, slightly older, including mine, who are very comfortable. So it's that marriage of expectation. The opportunity that we've seen, even in the last 6 or 7 months, again, virtual working as a society, the virtual ability to reach out and communicate, the way that we're working with each other, never mind just through health, is going through such a change. And I think the opportunity we have is to enable that digital health next phase, closely aligned with communication, brand expectation, and that assurance that digital health will deliver on its promises. But we'll work closely with our care community in the broader sense. But you can see that there is an epoch event happening right now, not only through COVID, but the whole capabilities. But still a proportion of our population have levels of anxiety that they need to come with us. And this is part of the challenge of communication and getting out there. So as we've both been involved, you and I, Amith, it's that clinical engagement, it's the patient engagement, and even beyond that, it's the citizen engagement and that level of those communities and fraternities being part of this process rather than being done to.
One of the challenges we face in the future is about, taking on your point about the digital health and workforce, is about the digital health workforce and the health workforce with digital health skills. Do you see them as one of the same or different? Or how do you see them emerging in the future?
So this is an area, Amith, that we're wrestling with right at this moment. We have established processes to ensure that digital education of the platforms we have rolled out, foundational pieces, electronic medical record, electronic medications management, etc., are well handled and supported. Going beyond that, it's always been the next step is to understand how do we bring, even all the way from undergraduate through postgraduate training, engagement through the practitioners who deliver health, and understanding how do we create a career of digital health enabled and capable staff. We also have, I'm blessed with, in the state of New South Wales, digital champions. Sometimes they dip in and out because, as our frontline practitioners will know, doing their job themselves, their role is often time challenging, and to take on extra roles sometimes comes and goes with family and work scheduling. But that's a challenge to harness and channel the digital champions to enhance and enable the capabilities of the healthcare workforce staff across the state, but also not predicting my next phase out of here, but CCIOs, percolating up from each of the districts and networks, and to have that career progression to being hopefully my replacement in many, many years to come. But that whole opportunity for the clinicians and practitioners across the state to be not only part of the digital process of the platforms that we choose, the platforms that we deliver, the education of how we optimize, because many of the features of all the platforms is that we really highlight that care capability beyond just the screen in front of us. So it's that interconnectedness, you've already called that one out, that ability to inform and share way beyond the immediate team or structure, and it's that force multiplier that comes through. And our education is very reciprocal and iterative, that the staff who are already using that, and this is how I got into the process of wanting to become a CCIO, was as challenge and frustration sometimes as a consultant for emergency medicine. I wanted it to do more. I could see great capability and potential, and I think that opportunity to both give a safe environment for our digital champions to come to the fore, have a career progression, also be very sensitive to the changing needs of our practitioners, have that wider scope of clinical engagement through education, training and support, and ultimately having a cadre of very capable senior clinicians and practitioners who will sit at the decision-making level, that in the future the decisions will be made very much reflecting the clinical and practitioner needs for the state.
That sounds very powerful, Mark, and good luck to your journey there as well.
Thank you.
Looking forward to working there with you. So that's all we have time for this episode. Thanks for joining me on the show. If you enjoyed the podcast, make sure to like, share, and subscribe on whatever platform you are on right now.